Okay, can you tell me if you can hear me, people? Just put a thumbs up if you can hear me. Good morning. Can you hear me? Yes, excellent. So let's start with today's session. This would be the topic on nutrition. The topic would be nutrition. And subtopic of nutrition would be protein, energy, malnutrition. So if at any point of time you have difficulty in understanding what I'm saying, please let me know. Please raise your hands. Please be active in such a way that I'll be able to deal with your queries. Okay, so let's start straight away. The world actually suffers because of two different things. One is something is in excess. The second is something is deficient. When it comes to nutrition, the same problem happens. In case of USA, UK, etc., there is a problem of obesity where you have people eating a lot of burgers and pizzas, as they say in Tamil movies. They eat a lot of these kind of stuff. They become extra obese. They have extra body weight. On the exact opposite side, in case of Ghana, Sudan, Ethiopia, Somalia, even in case of parts of India, we have a lot of people who do not have enough amount of nutrition. Now, when we speak about nutrition per se, remember, calories does not necessarily mean that we're talking about nutrition always. Calories is one of the ways by which I can supply energy, and that energy is only to make things happen. That is, for a particular mechanical function to happen or for a chemical function to happen. In simple words, biochemical function to happen. But calories are not the only things that are required for building up of your body. So remember, good morning all of you, thank you very much. So listen, you will be requiring more than that. For example, you divide the nutrition into macronutrients and micronutrients. Macronutrients and micronutrients. Why am I telling you this? As I have already mentioned in multiple classes in our college, I have said that if at all you think about a full meals in your normal thali, for example, a South Indian thali or a North Indian thali, the most important part of the thali would actually be the rice. That is, you think that rice would be maximal in size, or it can be rotis, depending upon which region you're coming from. But scientifically, that is not the most important component. In case of biochemistry, the most important components would be the veggies. The vegetables, for example, if you make mashed vegetables or you have stew, these are the ones who are supposed to provide you the nutrition that you require. Why? Because the vegetables are the ones who will provide vitamins, and the vegetables are the ones who will be providing minerals. And you require vitamins and minerals in proper proportion. And also you understand one thing, vitamins can be divided into fat-soluble vitamins and water-soluble vitamins. In terms of fat-soluble vitamins, I have already mentioned that if you want proper kind of fat-soluble vitamins to be taken up by your body, taking the proper kind of food alone is not important. Having a proper GIT is important. Having a proper liver function is important. Can any of you tell me how liver function can actually play a role in case of your fat-soluble vitamin absorption? Can any of you tell me how fat-soluble vitamins are related to liver? Good morning all of you. Excellent. Tell me how fat-soluble vitamins are related to liver. Anybody for that matter? I'll give you time, just try it. Take this as a session where you're trying to be helped by a faculty to finish your portions before you go for exams. Excellent, Gayatri. So you need bile salts for micelle formation. Excellent answer. You require bile salts for micelle formation. And if at all the bile salts are not coming out, what kind of jaundice you have? Absorption is required along with the fats. Excellent. Tell me, if bile salts are not coming out, what is your first suspicion? If bile salts are not reaching your duodenum or they are not coming into the intestine, what is your first suspicion? If they are not coming into your intestine, what is your first suspicion? Excellent. For emulsification of fats, all these things are needed. What is your first suspicion, people? Excellent. So you think about obstructive jaundice. Obstructive jaundice would mean to say that you need bile salts, but they don't get the bile salts because of an obstruction in the pathway. This is point number one. Now it means to say that because you're having a completely relevant disease called as obstructive jaundice because of the hepatobiliary system, you are suffering from another disease which is because of malnutrition. Also remember, you will be have certain kind of GIT disorders like celiac sprue. Celiac sprue. You have tropical sprue. You have Whipple's disease. Have you heard of these names before? Have you come across these names before? Excellent people, all of you are giving me the right answers. I will be continuously monitoring how many of you are in the top chat sessions of live sessions. Okay, just tell me, have you heard of these diseases called as celiac disease, tropical sprue, Whipple's disease, etc.? Yes or no? No, just celiac sprue. Excellent, not a problem. So listen carefully. See, your GIT is supposed to have proper kind of epithelial cell. If at all you hope for a chemotherapeutic treatment is mostly given for infections and for cancer. Mark my words, chemotherapy is the name given either for infections or for cancers. Many times we speak about cancers. Now if I put a patient on anti-cancer drug, can you tell me which kind of cells are the most commonly affected cells? Which kind of cells are the most common cells to be affected? If I put a patient on anti-cancer drug, what kind of cells will be most commonly affected? Okay, you all are giving me very slow answers. You're saying no for the previous question I asked 5 minutes back. I'm asking you a simple question. When you put yourself on anti-cancer drugs, okay, those that have to divide excellent membership, that is the right answer. Not saying liver cells, not saying tumor cells. Please understand why tumor cells are actually responding to anti-cancer drugs, because there is a gross difference between a normal cell and a tumor cell. What is the difference? A normal cell will have controls of the cell cycle rules. It will be going for a proper cyclin activity under control. But tumor cells are out of the control. They will not be listening to any kind of control. They multiply without control. That would mean to say that when they are multiplying rapidly, then they are the ones who will respond to anti-cancer drugs. If at all you didn't understand what exactly I'm saying, I'll try to make it as simple as possible. Imagine there is a running race. In that running race, if 4 people are supposed to run the race to reach the dead point, one culprit fellow is keeping an invisible string, almost invisible string, at the bottom of one of the areas here. If they're supposed to run like this, one fellow is tying a string from this area to this area. Tell me, who will be the first one to trip and fall over the string? The one who is running very fast or the one who is actually walking very slowly? Who will trip across the string? You will have a lag because of OBS. So I would want you to be with me and please overcome this lag with your focus. There's nothing else I could do about this because there will be a lag if I'm going to use OBS. And for me to use OBS, only when I use OBS in that particular system, you'll be able to have the picture here, you'll be able to see me and you'll be able to see me writing also. Okay, so your point is only those cells who are running fast are the ones who can trip and fall on the string. Likewise, if you think about cells, you have three different kinds of cells. The cells who multiply rapidly, the cells who multiply only occasionally, and there are cells who do not multiply at all, they become permanent. Can you give me an example of a cells who are permanent, those who will not divide much? Can you give me an example of a cell which actually does not divide much? It is remaining permanent. Excellent. So neuronal cells or the brain cells are the ones who will be very difficult to respond to this particular therapy. So it means if I throw any kind of anti-cancer drug on these kind of cells, the rapidly multiplying cells are the ones who will respond best. So if at all I think about tumors being attacked by the anti-cancer cells, One other thing you have to understand is in your body, the GIT, epithelial cell turnover, is more than 3 to 4 times in a day. So they can keep on turning over. When the turnover is very fast, then they are the ones who can be affected. And if at all the GI epithelial cells are under attack because of an anti-cancer therapy, the most common symptom would be, now watch very carefully, if at all you say cancer patients will have a lot of vomitus. The reason is that I'm just giving you real practical reasons for what exactly you're seeing in your life. If at all a cancer chemotherapy patient is coming up, what are the common things you notice when he comes out in the open? If a patient is trying to fight cancer and he comes out in the open, in the social media, what are the things you notice about the patient first? Excellent. So he will be bald, he will be having hair fall. Even in case of Yuvraj Singh, when you take into consideration, when people lose a lot of bunches of hair, the hair will look extremely ugly by spotted areas. That's why mostly tonsuring will be done. And why tonsuring will be done? Because hair follicles are one of the important cells who can be rapidly affected by the cancer chemotherapy. So remember, that is the side effect of cancer chemotherapy. The other thing that you can notice about the cancer patients would be they'll be continuously vomiting. They'll be having nausea. Nausea is the sensation of vomiting that happens before vomiting. And do you know what is the meaning of the word retching? Do you know what is the meaning of the word retching? R-E-T-C-H-I-N-G. Excellent. Weight loss can be seen. I understand. He'll look weak. Hair loss, weight loss can be noticed. Absolutely correct. Can you tell me what is the meaning of the word retching? Retching is not throwing up. The same as throwing up is vomiting. Retching is not vomiting as such. It is not the sound. Retching is that uncomfortable, unpleasant sensation. Uncomfortable sensation where all the chest muscles will go for contraction. Chest muscles go for contraction before trying to push the vomitus out. That is the place where you are actually scared of vomiting. Generally, we don't actually be scared of vomiting, but when the vomiting happens, we all have a very uncomfortable death-like feeling, right? The reason is that we'll have extreme amount of pain over the chest because we're trying to push something outside. That kind of pain would be the retching part. Okay, the moment of the vomiting, that sound produced. No, not just the sound. It is about the pain that happens over the chest muscles because we're trying to push something outside. So all these things, why am I teaching you? If at all you think about a GI muscle, if I think about GI epithelial cell, an anti-cancer therapy will be able to attack your GI epithelial cells in such a way they will cause erosion of the epithelial cell. Now, can any of you tell me from the chapters that we learned in tryptophan, whenever we have erosion of epithelial cell, what chemical substance can be released? What chemical substance can be released? Anybody remembers from the previous classes? Excellent, Purna. The answer is serotonin. What is serotonin? It is 5-hydroxytryptamine. 5-hydroxytryptamine is serotonin. And this serotonin will go back. Whenever a particular epithelial cell is irritated, serotonin will be released. That serotonin through the blood, through the GIT, it will be reabsorbed into the gastrointestinal circulation, that is called as enterohepatic circulation. Then it crosses over to the systemic circulation. Through the systemic circulation, the same serotonin will be able to enter into the chemoreceptor trigger zone. Where is the chemoreceptor trigger zone? Do you know what is the chemoreceptor trigger zone also called as? Serotonin will go and knock on the receptors. Serotonin released from the GIT will go and knock on the receptors, which are chemoreceptor trigger zone receptors. What is this CTZ also called as? Anybody knows? No, not medulla, not aortic bodies. Anybody with an answer? The CTZ is also called as what? It's called as area postrema. And this area postrema is also called as vomiting center. the vomiting center of your body. Mark my words, in anatomy, when you're trying to learn about these centers, you have to understand the vomiting centers are lying outside the blood-brain barrier. Outside the blood-brain barrier. Okay, now with this information, let me tell you, if at all a patient is on cancer chemotherapy, he will be having a lot of vomiting, and vomiting would mean to say that he will not be able to take enough amount of proper nutrition also. Proper nutrition absorption will not happen. So when I spoke about the diseases like celiac disease, tropical sprue, Whipple's disease, in all these things, one thing is common, there is malabsorption. And when there is malabsorption, because of poor absorption, the patient will have poor nutrition. That can also be the reason for malnutrition. Now, let us start with one simple question. I am able to see the top chat actually decreasing. Now, please be with me. Let me show you a picture here. Tell me, what are the features that you notice about the child here? From this picture, what are the things you notice about the child? You're having a child on your screen. Can you tell me the things that you notice about the child? Excellent. The child is showing pot belly. What about his arms? Ascites might be a reason. Please understand, just because there is pot belly, you can't always say ascites. It can even be splenomegaly, it can be hepatomegaly also. Unless you go for physical examination, you will not be able to exactly say what is the reason for such a kind of pot belly. Okay, so we have pot belly. It can be because of ascites. We'll go to that next. What about the arms? Excellent. Thin limbs. Amazing. You have thin limbs. And you also notice muscles are wasting. Muscles are wasted. Now, what about his mood? What do you think about his mood? Hair is thin and grey. Excellent notification. Please understand, his hair is also thin and grey. Tell me, what do you think about his mood? Is he looking agitated? What about his mood? Is he looking agitated? He's looking depressed is what you're saying. Yes, I understand grey hair, thin limbs, all are possible. But tell me about the mood. Is his mood looking agitated? He looks depressed, but more than depressed, he is looking dull. He is looking lethargic, and he is actually looking lazy. He does not have much of interest in the surroundings. So loss of interest in the surroundings is what you notice in this kind of case history. Now I'm going to tell you the diagnosis. The diagnosis of this case, I'm going right at the top bottom. The top area, left area, right down. The diagnosis is kwashiorkor. The diagnosis of this case is kwashiorkor. Yes, he is not agitated. Excellent question. Now, let's look at this question here. Try this MCQ. We'll go for an answer. Which of the findings in this child shown at the right would support a diagnosis of kwashiorkor? Go for it. In the options A, B, C, D, E, you can choose any option that you feel like. Okay, so Lucifer Man says it is E. Has markedly decreased weight for height. Anything else? Karthikeyan Kumar says it is D. Displays abdominal and peripheral edema. D and E are the most commonly chosen answer. Anybody else with any other answer? Okay. Good. So it is done. It is to be understood that it can either be D or it can be is what you're saying. E has found the most common presentation. But I'm sorry to say the right answer is D. Please take a note of this. The right answer is D. The answer E is wrong. It markedly is the most important key word here. In this question, if you expect decrease in weight for height, it is possible. I repeat, if you expect decrease in weight for the given height, it is possible. But to call it as markedly decrease, then it is wrong. So on that basis, option E is wrong. Okay, now look at option C. Appears plump due to increased adipose tissue. Is it true? Do you think the patient is appearing plump as a whole? Is he looking like an obese child? In this picture, does he look like an obese child? Tell me, does he look like an obese child here? No, the child is not obese. You just now told me that the muscles are wasted, he is having thin limbs. The only place which is appearing huge would be his belly region. Except in the belly region, no other area is looking very large. So that is what I want you to understand and focus on. So here you understand that the child is a case of kwashiorkor, and kwashiorkor is a condition. I'll write it here. I am going to erase all the annotations I have written. Kwashiorkor is a condition where you expect. Kwashiorkor is a condition where you expect protein deficit. Protein deficit. Now there is one more condition called as marasmus. Marasmus is a condition with energy deficit. Energy deficit is actually a calorie deficit. Please take a note of this. Please take a note of this. It is energy deficit. Kwashiorkor is protein deficit. Now how do I remember? Now look at this. If at all I say glycolysis is happening, what is the purpose of glycolysis per se? What is the purpose of glycolysis per se? ATP. Now ATP is a chemical form of what? ATP indirectly means you're producing what? You're generating what? Excellent. Energy production. Now tell me, in these two conditions called as marasmus and kwashiorkor, which one is deficient in energy I told you? In case of kwashiorkor and marasmus, which one is deficient in energy I told you? Excellent, all of you. Just tell me, between kwashiorkor and marasmus, which one is known for energy deficit? Just now I told you. Yes, correct. Marasmus. Now, can you tell me the other name of glycolysis? Enough. Stop. Tell me, what is the other name of marasmus? Okay, what is the other name of glycolysis? Just tell me that. What is the other name of glycolysis? From school, when you learnt about glycolysis, what pathway is the other name of glycolysis? What is the other name of glycolysis? Oh God, thank you very much for your answer. I understood it is marasmus, but you're very slow. Just tell me, what is the other name of glycolysis? Excellent. EMP. What is EMP? Emden, Meyerhof and Parnas pathway. Parnas pathway. Now you have E here, you have energy here, and it means you have glycolysis here, you have marasmus here. So try to understand EMP shunt. EM. Emden, Meyerhof. Energy, marasmus. Remember, energy, marasmus. You get my point, people? I'm not only giving you a mnemonic, I'm trying to give you the logic behind what exactly is happening. Energy means calorie, calorie means glycolysis. Glycolysis would be actually the reason for the coming. Did you get my point, people? Just put a thumbs up if you're okay with this. Did you understand this? Why am I telling you? Because even in case of pediatrics, this topic is not only important for biochemistry, this topic is very important for pediatrics. In pediatrics, you are expected to make a diagnosis of kwashiorkor and marasmus, and whenever somebody tries to teach you in pediatrics about this, you should be in a position to teach them better. I'm telling you this, if at all a pediatrics teacher comes and tries to teach you this kwashiorkor and marasmus, your understanding of this topic should be so well that you should be able to tell them the hardcore basic facts about biochemical reasons behind why certain things are happening a certain way in case of kwashiorkor and marasmus. So I hope you will be able to use this. Now what am I saying? If at all there is a deficiency of proteins, I'm going to erase all the annotations here. If there is a deficiency of proteins, when a patient is suffering from protein deficiency, it is case of kwashiorkor, then the proteins would mean to say that they will be the basis, that is outside. This is exogenous food. Exogenous source of proteins are important to bring down amino acids, and those amino acids can be useful for synthesizing proteins again inside my body. What I bring from outside is proteins. We don't eat spoons of amino acids. We just eat food. The food does not contain simple amino acids. The food contains proteins, and those proteins are taken by us. The proteins will be digested and they'll be absorbed as amino acid, and those amino acids again will rebuild inside my body as proteins, and those proteins can be divided into two forms. One is structural proteins, the other one is functional proteins. Example of structural proteins can be any kind of wall forming structures. In case of proteins, the enzymes are examples of your proteinaceous functions. So remember, for mere structure and functions also, you require proteins from outside. And if a patient is suffering from kwashiorkor, then proteins are deficient. So albumin will become deficient in that patient. Now albumin contributes to what inside the blood vessel wall? Can you tell me? Albumin contributes to what inside the blood vessel? Albumin contributes to what inside the blood vessel? Excellent. It can contribute to the osmolarity, it can contribute to the oncotic pressure. Now you tell me, if I say albumin contributes to oncotic pressure, and if the albumin inside is the blood vessel, then where will the water be? Where will the water be? If albumin is inside the blood vessel, where will the water be? Yes, oncotic pressure, that is the right answer. Just tell me, if albumin is present and situated inside the blood vessel, where will the water be? Inside the blood vessel or outside the blood vessel? The water. Inside the blood vessel. Now I'm telling you, if a patient does not have albumin, the content of albumin inside the blood vessel is massively decreasing, then the water will be shifting outside into the interstitial fluid. Now tell me, accumulation of fluids in the interstitium would be referred to as what condition? Accumulation of fluid in the interstitium is called as what? Excellent. When the albumin moves out, or the albumin is not enough inside the blood vessel, and when the fluid moves out of the blood vessel into the interstitium, what do you name it as? It is called as edema. So now you get my point. Answer D is correct. It displays abdominal and peripheral edema. Abdominal edema is because of ascites, and peripheral edema is because of the decreased oncotic pressure, and both can be because of poor protein handling by your body, because there is no protein at all. So tell me, can option A be true? Me whether increased serum albumin can be a true statement in case of kwashiorkor. In case of kwashiorkor, the serum albumin will be lesser than normal. And at this point of time, what is not deficient generally in case of kwashiorkor? Tell me, if protein is deficient, what is generally not deficient? In kwashiorkor, what is not deficient? Excellent. Calories is not deficient. And when will you become hungry? When you have less protein or less calories? When will you become more hungry? When you have less calories or less proteins? You tell me using your common sense. Jaswita, vitamins is not the reason for having hunger at all. Hunger pangs are because of less calories or less proteins? Less calories. So, because kwashiorkor is primarily not a problem of the calories, he shows a good appetite is not a true statement. So, here you have to understand this is actually a calorie state, but the appetite need not be good because he has enough amount of calories. I repeat, because he has enough amount of calories, or the calories is not the primary problem, his good appetite is not correct, he has less appetite. Appetite means hunger, and he does not appear plump, he appears swollen only in such areas where there is edema, and there is increased adipose tissue is not a true statement. You can have decreased adipose tissue but increased free fatty acids. He has markedly decreased weight for height is a false statement because the total body weight does not actually fall. Calorie fall will be the reason for the total body weight fall. Mark my words here. Write it down here. Total calorie fall would be the reason for total calorie fall would be the reason for body weight fall. So now tell me, in which disease will you have body weight fall then? In which disease the body weight fall will be massive? I'm putting forward a statement that whenever the total calorie is falling, the body weight can start falling. Yes, excellent. So in case of marasmus, you can expect body weight to be lesser. Can any of you tell me why in total calorie fall the weight is falling? Why in total calorie fall the weight is falling? Anybody can tell me that? I'd be happy if you can give me an answer. Yeah, energy is less. Why weight is falling? If energy is less, why weight is falling? Excellent. Ultimately, that is the point. So when you don't have enough amount of calories from the food, when you don't have enough amount, you have less amount of calories from the food, then you will start utilizing the proteins, and the proteins will go for catabolism, and because of the catabolism of proteins, you are trying to melt the proteins for fuel, because of which body weight will be markedly decreased in case of marasmus. So what is my point? Option E is purely meant for marasmus. It is not meant for kwashiorkor. So I'll give you 1 minute time. Now, can you look into the internet and tell me the meaning of the word marasmus? Yes, muscle proteins are broken down for obtaining energy. I'm telling you, just find out the meaning of the word marasmus. Find out the meaning of the word marasmus. Tell me now, I'll wait online. I'm asking you to find out the origin, etymology of the word marasmus. I'll tell you the etymology of the word kwashiorkor. Kwashiorkor means the problem faced by the first child. Problem faced by the first child when the second child is born. When the second child is born. You might have heard of a concept called as sibling rivalry, is it not? You will be having a lot of sibling rivalry, that is, both the siblings will be competing for the same kind of love, affection, nourishment and nutrition from the same parents. So if at all one sibling is given more attention, the other sibling becomes extremely angry and annoyed. So sibling rivalry can be taken as a psychological form of this particular situation. Kwashiorkor is a condition where the problem is faced by the first child when the second child is born. Okay, so marasmus means withering. Excellent. Marasmus means withering. The withering is happening because the person is actually losing body weight. Now, can you tell me what is the physical problem faced by the first child when the second child is born? You tell me what is the problem faced? What is the problem faced by the first child when the second child is born? Excellent. Mother's milk can be C. Mother's milk. Excellent. Then people, for a minute, my face will be stuck for 3 minutes because the camera has stopped functioning, but whatever I write here will be visible. Okay, less care. How is the less care seen? You tell me, how does it manifest as? Of course, there's less attention, but physically, body-wise, what are the difficulties you see? See, what you're saying is philosophical. Whatever you're saying would be philosophical, emotional, social. I'm not asking you about any of these things. I'm asking you, biochemistry wise, nutrition wise, what is exactly happening? Less amount of food. Food means which food? That is my question. Weak body, poor feeding. So I'll make it as simple as possible for you. Listen very carefully. It means poor breastfeeding. Poor breastfeeding. Breastfeeding is an important source of proteins and a sugar called as lactose. And breastfeeding is important for immunoglobulins also. So in all these conditions, you can expect the particular first child to suffer. So when the first child suffers, and if at all breastfeeding is very poor, can you tell me, because of poor immunoglobulin transfer into the fetus or into the child, that is an infant, what is the most important problem the child faces? Food with high calories is not your point. I'm asking you, if poor breastfeeding is happening and the immunoglobulin transfer is very weak, what is the problem that the child will face? Excellent. Point number one, essential amino acids will be very poor. Good, Karthikeyan. Essential amino acids will start dropping. Then, what else? Excellent. Less immunity. What is the problem in case of less immunity? It means recurrently what will you be facing? If the child is having less immunity, what will the child face? Excellent. So the most important point is recurrent infections. Recurrent infections. Can any of you tell me the most common disease of the childhood? Can you tell me the most common infectious disease of childhood? Can you tell me the most common infectious diseases of the childhood? Excellent people, I'm really proud of you. I'm very happy. The way that you're answering these questions is better than many other students that I have seen all over. Excellent. Common cold? No. See, now for all the people who said common cold, I have one question for you. Common cold happens only in case of low immunity? Just answer my question. Does common cold attack people only with low immunity? So tell me, killer diseases of childhood. What you have learned from the common sense statements from the world of health, not just as a medical student but also as a common person, a layman. Tell me what are the most common infectious diseases of childhood against which vaccinations have been given. Excellent, Suhirta. Measles. Any other answer? Good answer. Chickenpox, measles, MMP, diphtheria, whooping cough, tuberculosis, hepatitis, polio, cholera. Cholera. Oh my God, cholera is a disease of childhood. Smallpox. In which world are you people? Smallpox is eradicated. Since 1980, not a single case has been reported. Not smallpox. Malaria of childhood. Okay, amazing. So I have enough answers. I'm happy that you're able to give me the answers. I'll repeat this for you. I'll just give you a compilation of all data. Measles, mumps, rubella, then you have diphtheria, pertussis, and tetanus. These are the most common diseases that you have to know. And out of all these, the one that you should be very scared of, very scared of, should be measles. Why? Because measles will create a triad. Just give me 1 minute. I'm still not able to use my camera. Okay, I hope. Can you see me now? Can you just tell me if you can see me now? Please put a thumbs up if you can see me now. Okay, thank you very much. Okay, let me have a very short 30 seconds to 1 minute break. Let me talk to you. How is your summer? How are you all people doing? How is life back at home? Are you all safe back at home? Boring. Okay, you are bored. So the point is, even if you are bored, you still do not want to come to classes to learn. That is what is my point. Great people you are. Emijo says it is nice. Okay, what are you doing, Emijos? Super, yeah, I understand. If you're very far away from all of us, you're very happy, right? What is your way by which you're keeping yourself entertained, Emijos? We are safe. Wow, Amy Jose is the grandma, is it? She is actually talking like very responsible person. I am very proud of you, Amy Jose. I'm understanding that you all are safe. I'm really happy you're all safe. I'm asking you, what are the good things you do at home by being safe? Nivisha says Netflix. Wow. Now let me come back to Amy Jose. Apart from being safe, what else are you doing, Amy Jose? You said nice, right? I'm happy. Reading. Wow, Amy Jose, you're reading. Amazing. Okay. Nivedita says she's sleeping. Okay, Venkat is saying watching series, spending time in family with time. Yes, correct. If you're capable of spending time with your family, you should be very happy for it. When you're saying it is very boring, once the lockdown is over, you'll start missing your family. You start missing how lazily you can wake up in the morning, how lazily you can go back to sleep. You can sleep very late in the night. You can wake up at any time. If at all there is a class, you can come and sit in the class. Otherwise, you do not have to do it. All these things you'll miss. So please be happy. Varsha is eating. Wow, Ludo King 5. Okay, PUBG. Kanishk is playing PUBG. Amazing. Workout. Oh, Sivaramchandru, you're working out. We'll see muscles from your side. Next time when you come to the class, I'll see your muscles. We'll send you for your muscles. Okay, now let's come back to the topic. Infectious disease of childhood is what we are discussing. House party. Wow. Okay, Bharadwaj, your question was correct. Hepatitis B can be an infectious cause of jaundice. That is understandable. But I'm asking you the infectious disease of childhood. It means only children are the people who are supposed to be most commonly affected. And if at all you're thinking about measles right now, you don't get measles. If you think of mumps, you won't get mumps. You won't get rubella now because you have been vaccinated very early. And if you are not vaccinated, they are also called as killer diseases of childhood. Killer diseases of childhood. Now, what is the purpose of me teaching you all these things? Remember, okay, yeah, I understand. Now, what is the purpose of killer disease of childhood and knowing all these things? Now, let's make a triad. What is a triad? The three things that are always common, one will amplify the other. For example, I have X, X will amplify Y, Y will amplify Z, Z will amplify X. So, all these things will keep on happening in turns. So, that would mean to say that measles will lead to vitamin A deficiency. And vitamin A deficiency can lead to blindness. Blindness, and along with that you can have other kinds of infections. Infections would be because of poor immunity, and the immunity will again lead to more serious infections of measles. So I'll erase whatever I have written here. I'll just repeat these things for you. I'll write it here. If at all you're suffering from measles, measles will make sure a person will have lesser amount of nutrition. During the measles period, the child will not be able to eat properly, so poor nutrition. Because of poor nutrition, you have poor immunity. And because of poor immunity, again you will have more measles infection. And this nutrition will be most commonly affecting vitamin A. This can be important for your MCQs, this can be important for your quiz questions, and they will be asking you even in the third year subjects in the form of social and preventive medicine. So please remember this. Measles is related to low nutrition. Low nutrition can lead to low immunity. Low immunity can lead to again more measles, and in that process the nutritional component involved would be vitamin A. Did you get my point, people? S. Now let's go for the slide here. Now look at this. This particular, mark my words, kwashiorkor and marasmus both can become a 10-mark question for you. This is a 10-mark question for you. It can be an essay question, or if they can ask you only about kwashiorkor as a 5-mark question, and these will definitely be a part of your nutritional study. So make sure you remember this. Now, what are the types of protein energy malnutrition? Remember, when I use the word protein energy malnutrition, protein is also affected, energy is also affected, but who is more commonly affected? If protein is more commonly affected, it is mostly towards the kwashiorkor. If you start the UV light spectrum or the visual spectrum, you start from the V, you go till the R. It means what? There is a difference in the wavelength of each of the color, but ultimately all belong to one component called as visible light. But the visible light is spread into multiple layers. Likewise, kwashiorkor is one end of the spectrum, while underweight child is the other end of the spectrum, while marasmus is the other end in terms of concepts. I'll repeat it here. Look at this. If I say kwashiorkor is one end to make a diagnosis, the other end can be marasmus. What happens in kwashiorkor? In kwashiorkor, protein intake is very, very less, right? At this point of time, liver will suffer from fatty liver. Can you tell me what is the reason for this? Excellent, people. In kwashiorkor, why do you suffer from fatty liver? Can any of you tell me? In kwashiorkor, why do you suffer from fatty liver? Can any of you tell me? Okay, protein is less, that is kwashiorkor. Accumulation of TAG. Why accumulation of TAG? That's a very good answer, Shruti Kumar. Why there is increase in TAG in the liver? Why? That is my question. Why there is increase in triglycerol in the, yes, why there is fatty? Fatty liver means fat accumulation. Why it is happening is my question. Liver works more to produce energy. No. Anything else? Any other explanation? More fat breakdown. I have already told you that. I'm asking you, even though there is more fat breakdown, why is it accumulating in the liver? Excellent. Jyotika got the right answer. Please understand, in kwashiorkor, when the whole concept of proteins are low, lipoprotein synthesis is affected. Lipoprotein synthesis is affected in case of kwashiorkor. So that would mean to say that mobilization of lipids is poor. Mobilized fats, poor. It means all of them will go dump the lipids in the liver. Dumping of lipids in the liver, because of which you have fatty liver. So the answer is, please remember, lipoprotein synthesis is very clear, very less in case of your fatty liver, especially in case of kwashiorkor. Okay, now let's discuss the differences. This is a WHO classification. I'll give you time. Please take it down if you want. For those people who are taking notes with your notebooks, write down, this is WHO classification. There is one more classification called as IAP classification. Can you tell me what is the full form of IAP? WHO is World Health Organization. What is the meaning of IAP? Anybody? Excellent, Shivani Venkatesh. It is Indian Academy of Pediatrics. So there is one more classification called as Indian Academy of Pediatrics. There is another classification called as WHO classification. Both of them can have different variations in the way they classify the protein energy malnutrition. So mark my words, kwashiorkor is one spectrum, marasmus is the other spectrum. There is a condition called as marasmic kwashiorkor, which means the combination of marasmus and kwashiorkor as a problem can be seen. Now tell me, in the MCQ that we discussed, where was the weight for the height extremely poor, markedly decreased? It's a property of whom? From the MCQ. From the MCQ point of view, tell me, where did you find fall in the where do you find marked fall in the weight for the given height? Excellent, marasmus. So look at this here, percentage of body weight compared to standard weight. That is, if you take any kind of standard child and you try to keep it as the 100th percentile, in kwashiorkor you will be able to meet 60 to 80% of the standard weight. But in case of marasmus, it is less than 60% of the standard weight. And edema should be most commonly a problem of whom? Is it the problem of kwashiorkor or marasmus? Excellent people, very good going. Tell me, if at all you speak about edema, edema is a problem in case of poor oncotic pressure, and poor oncotic pressure is because of proteins. So who will be the most important one that is the reason for edema, kwashiorkor or marasmus? In case of edema, which one are you concerned about, kwashiorkor or marasmus? Excellent, kwashiorkor. Why? Because kwashiorkor is protein deficiency. In case of protein deficiency, albumin will fall, oncotic pressure falls. So either in kwashiorkor or in case of marasmic kwashiorkor, you can see edema. And you may expect deficiency in weight for height, possibly. But the most important condition where the deficiency in weight for height happens would be marasmus. Now, these things should be differentiated from two other conditions called as nutritional dwarfism and underweight child. Underweight child will actually look like kwashiorkor itself, but underweight child will not suffer from edema. The child will not suffer from deficiency in the weight for height. Why? See, if weight for height is not deficient, but weight is deficient, what else does it mean? Can any of you tell me? If weight for height is not deficient, but weight is deficient, so what is your other understanding? Excellent people, very good understanding. Height is also less. If I say weight is less and height is less, if both of them are proportionately less, then the ratio will be normal. The ratio is normal. This is another condition called as your underweight child. Because of this, you have to understand the child was basically born as an underweight child. So in those child, you will be having the value similar to that of 80 to 60, but there is no specific protein deficiency or enzyme energy deficiency. So edema will be absent and the ratio of weight for height is also normal. And the same thing can be applicable for nutritional dwarfism. In case of nutritional dwarfism, dwarfism is what we are saying. It means to say that percentage of body weight compared to standard weight is lesser, but there is no edema, no deficiency in weight for height. Here also the ratio is normal. So I'll give you a simple logic. What is nutritional dwarfism? We have two things. One is nutritional dwarfism. The child is having stunted height. The child is having stunted height. There is one more thing called as underweight baby, underweight child. These are the two things who have to be differentiated from protein energy malnutrition. Why am I telling you this? you will be having MCQs based on these concepts in case of pediatrics. Not just in biochemistry, you will have MCQs in pediatrics based on this. You have to differentiate protein energy malnutrition from two other conditions called as nutritional dwarfism and underweight child. If it is nutritional dwarfism and underweight child, what is common to both of them? For both of them, you'll understand that in both of them the common features are no edema and normal weight by height ratio. But how will you differentiate both of them? How will you differentiate nutritional dwarfism from underweight child? Dwarfism means height is most commonly affected. If I am saying height is most commonly affected, still the ratio is more commonly maintained, then what does it mean now? People, I'm asking you a very simple question. In case of underweight child, the ratio was normal because both of them were less. Now I'm telling you, dwarfism speaks only about the height. In case of dwarfism also, the ratio is normal. What does it mean? Excellent. So weight is less. Now this is where you will be finding one common focus here. Now in case of underweight child, what is the most important parameter you have to see? Weight or height? Excellent. Now tell me, in case of your underweight child, who is the most important parameter? Yes. Now I understand your answer for the previous question. I'm asking you, in underweight child, which parameter are you supposed to focus on? Excellent, weight. So in case of underweight child, the most important focus of yours would be weight. In case of dwarfism, your most common focus would be height. So how will you go for a mathematical understanding of this? In case of nutritional dwarfism and in case of underweight child, the percentage of body weight to standard weight is extra lesser in case of dwarfism. This is the baffling parody. Mark my words, it's called as a parody. You will be having a paradox. What is a paradox? Though I call it as underweight, underweight is speaking about weight, right? So this particular parameter is telling you percentage of body weight compared to standard weight. Compared to standard weight, underweight child is actually able to maintain up to 80%. But the dwarfism child is the one who is gone, I'm not able to maintain 80%. It is less than 60%. So this is how you'll be able to differentiate between that of nutritional dwarfism and underweight child, which is completely different from that of kwashiorkor, marasmus and marasmic kwashiorkor. Okay, now let's go to the biochemical section of learning about this particular. We'll go for the biochemical things to be taken into consideration. Give me 1 minute. I'll add one more slideshow. Okay, look at this. Biochemistry wise, what differences can you see? What differences can you see in case of kwashiorkor versus marasmus? So we'll go back to this table. Now look at this. Marasmus technically attacks children less than 1 year, while kwashiorkor attaches children more than 1 year. More than 1 year children, less than 1 year children, that is the gross difference. You have to know this for sure. If at all a child is 36 months of age, think about kwashiorkor more than marasmus. This is so nutritional dwarf will have lesser weight than underweight child. Yes, that's a very good answer. That is what is the paradox I'm saying. Okay, a deficiency of calorie versus protein. That is what we discussed all these while. In marasmus, calorie will be lesser. In case of kwashiorkor, protein will be lesser. But what is the reason for marasmus? You will be having early weaning and repeated infection. What is meant by weaning? Does anybody know what is the meaning of the word weaning? What is the meaning of the word weaning? W-E-A-N-I-N-G. What is the meaning of the word weaning? Okay, so the answer is correct. Weaning means that the breastfeeding is stopped. So, if at all, what is the best way to give, what is the best amount of time till the breastfeeding can be done for a child? See, breastfeeding is not a taboo. People may feel embarrassed about it. It is not a taboo. Breastfeeding can be given as long as the mother wishes to. As long as the mother wishes to. This is psychologically, socially, conventionally acceptable. It can even be up to 3 years or even 4 years. If the child is very poor, the mother can keep on giving the breastfeeding milk for the child. But if at all a mother is a working mother, or if the mother is a daily laborer, she can't give breastfeeding every single day, and if she actually gives the child to somebody else and then she allows bottle fed children to be grown, then early weaning happens. In case of early weaning, what is the most important problem? Breast milk is filled with a lot of immunoglobulins, right? So the chances of having repeated infections will be higher. Now, what is the difference in case of kwashiorkor? Tell me, in kwashiorkor, what was the reason? Yes, excellent, Sri Swaminathan. Transition from breastfeeding to normal food. Tell me, in kwashiorkor, what will be you saying that there is a starchy diet? What is the reason for starchy diet now? See, starchy diet, why am I giving after weaning? What is the meaning of the word kwashiorkor I told you? Go to the concept of the meaning of the word kwashiorkor. What is the meaning of the word kwashiorkor I told you? It is a problem of kwashiorkor is protein deficiency. I'm asking you the meaning of the word kwashiorkor, etymology of the word kwashiorkor. The problem for the first child because the second child is born. So what it means, see, the mother is not stopping the breastfeeding, but the problem is she's transferring the breastfeeding to the second child, because of which the first child is not able to get the breastfed food, because of which the child is getting starch, that is in the form of cereals or in the form of rice. The child is getting rice or fluidy rice, because of which the first child is not getting enough amount of milk. So growth retardation is extremely marked in case of marasmus, not in case of kwashiorkor. So if in case of marasmus, if the calorie content is very less, I'm going to erase all the annotations here. Look at this. In case of marasmus, because calorie content is very less, what is the physical symptom you see? I told you, right? When the physical symptom, what is the most important physical symptom you see? When the calories are very lesser. What is the tagline of the advertisement for Snickers? No, not decreased weight. Calorie does not actually speak about decreased weight as the primary symptom. I'm asking you, what is the tagline of the ad, Snickers? Tiredness, weight loss, tiredness, weight loss. I understand it is the ultimate result. It is the end result. Will weight loss happen over 2 hours? If, for example, right now I'm not having calories, at 3 o'clock in the afternoon, will I have weight loss? Yes, pasita ni niya irukka maata. That is what is the problem. Excellent, Sneha Lakshmi. Listen very carefully. Hungry, grab a Snicker. Hey, idella robba palasya. Snickers. When you are hungry, you will not be like yourself. You will act like a heroine, is what the ad says, right? So the most important symptom you have in case of calories would be increased appetite. So for those people who are confusing between weight loss and appetite, I'm just giving you a simple example. If I'm actually not having enough calories, I did not take my food in the morning, what will I actually feel? What will I suffer from? Will I suffer from body weight over a period of just 2 hours? If that is the case, I would have lost body weight by mere starvation over 3 or 4 days period, right? So, if at all I'm not eating, or if I don't have enough amount of energy in my body, the first symptom I see would be hunger. That is why I'm telling you, hunger is very high in case of, the hunger is high or normal in case of marasmus. But in kwashiorkor, the energy is not a problem. That is why you have anorexia. In fact, appetite is less than normal in case of kwashiorkor. Why am I telling you all these things? Because I want you to not make a mistake. When they give you a case history, if they say the child is extremely hungry or crying for food, then you have to think about normal appetite, you have to think about marasmus. All these are pointers to make your diagnosis. Now look at the attitude. If at all you are actually hungry, just now you said, Pasicha ni niya irkamata, you become extremely irritated, right? So irritable children and fretful children are marasmus children. While the Kwashiorkor child is not having any kind of feeding disorder, the Kwashiorkor child is not having any kind of hunger, because of it, the child will actually go to a corner, it will be apathy. Do you know what is the opposite of apathy? Don't tell me pathy. Can you tell me what is the opposite of apathy? Empathy can be taken. Can you tell me what is the opposite of love? What is the opposite of love? Enthusiasm. Bharatwaj, wow. Enthusiastic child, huh? Okay, so for those people who said hate is the opposite of love, it is wrong. Love turned bitter is actually called as hate. Hate also means you are invested. If, for example, you say that you love someone, it's a positive kind of feeling. If you say you hate someone, that is also a type of love. Your thought process are completely invested in that particular thing. In spite of you hating it, you still think about it. But the opposite of love is not hate, it is apathy. Apathy means what? You don't care anymore. That is the exact opposite of love. Please understand, it is indifference. Excellent, very good, Suhirta and Harini. The point is, the opposite of love is apathy. You don't feel anything for him. If the person is successful, you don't feel happy for him. If he is actually a failure, you don't feel sad for him. But if at all you hate someone, if he is successful, you will become sad. If he is sad, you will become happier. In case of love, if at all the other person is successful, you will feel happier. If the other person is failing, you will be sad. So the concepts are very clear right now. Apathy would mean indifference. So please understand, the child will have apathy, no association with surrounding feelings, the emotions will be blunted, the child will be lethargic. At the same time, the child will look plump, but the child is not obese, the child will look plump, and the plumpy look is because of edema of the face and the lower limbs. While in case of marasmus, the marasmic child will have all the faces coming opening together. Look at this. I will remove all the annotations here. Look at the marasmic child. The marasmic child will have shrunken skin. Shrunken skin, bony appearance of face will mimic what? If a child is having shrunken skin with the bones and the face will resemble which kind of animal? The hair is distorted. See, all these are malnutrition, I understand. See, marasmus is also malnutrition, Kwashiorkor is also malnutrition. Kwashiorkor is malnutrition with respect to protein, marasmus is malnutrition with respect to energy. I am asking you, shrunken with skin and bones only, excellent Sneha Lakshmi, it looks like a skeleton or it looks like a monkey. So, monkey faces is a property of marasmus. It will not be given in your textbooks right now in biochemistry, but I want you to understand porcupine. Oh my God, Varsha, I am really proud of your imagination. I did not draw the line like this, I drew it like this. So how can you ever think of porcupine in this condition? I don't know. So it is Hainava. Day multi awesome. Who are you, man? Ippulla badal solra. Shankar with skin and bones only. It is not actually hyena or porcupine. It looks like a monkey. Have you ever seen a monkey when you have gone for any kind of hill stations? In that area, you'll see the bony prominences will be very prominent. The maxillary areas will be prominent. The eyes will be sunken and will be looking dehydrated. Monkey faces. So monkey faces is a property of marasmus. Okay, now look at it. Look at the skin. The skin will be dry and atrophic because no energy. You will be utilizing all the proteins and fatty acids present all over the body, and you will not have enough amount of moisturization. Moisture is less in case of marasmus. Now this is an MCQ statement. Write down this part very clearly. Crazy pavement dermatitis is a property of Kwashiorkor because the protein content is very less. Proteins are important to maintain the supple nature along with that of fatty acids. Proteins plus lipids together will maintain the supple nature of the skin. Because of the absence of this, peeling of skin can happen, cracking of skin can happen. Degradation means loss of skin. Loss or flaking of skin can happen. So if they say flaky skin, think of kwashiorkor. If they say dry and atrophic skin, think of marasmus. I'll write it here. The most important keyword, you have flaky skin. You have flaky skin. Here you have atrophic skin. Okay, now tell me, where have you heard about flag sign? Korangutan. Hey, அது orangutanra. இன்ன புதுசான வார்த்தை சொல்றேன். Korangutan ஒரு organism இருக்கா? Okay, now tell me, what is called as flag sign? Flag sign. Shipsa. டேய் என்ன பேசுறீங்க? நான் என்ன கேக்குறேன் நீங்க என்ன பதில் சொல்றீங்க? You will see flag sign in the hair in which conditions? Oh, Ashik Ahmed, நான் என்ன பேசிட்டு இருக்கேன்? We are speaking about flag signs in gel medicine. Why are you speaking about ships and the communication between ships? I'm asking you, flag sign. Look at this. If at all you think about the hair will look darker in one zone, again it will be fairer in one zone, again it will become darker in one zone. So if you look at the hair, it will look like this. This area will be colorless, this area will be colorful. Now this flag sign can be seen in which conditions? Okay, melanin deficiency, that is excellent. It can be found in tyrosine metabolism. Can you tell me which element is important in tyrosine metabolism? Yes, which element is important in melanin synthesis? Element, metal. Excellent. So you can think about copper. In case of copper deficiency, you can expect flag sign. In case of abnormal tyrosine metabolism, you can expect flag sign. And tyrosine metabolism involves enzymes. And enzymes involves proteins. And because in kwashiorkor proteins are deficient, almost all the enzymes can become slowly deficient, because of which improper pigmentation of hair happens. And please remember, you can have sparse, soft and thin hair, curls may be lost, and the hair is extremely weaker. Also remember, the proteins are required for follicular strength. Follicular strength also requires proteins, and the protein loss is happening, you'll automatically have kwashiorkor with poor kind of hair. Hair fall can be seen. Now, have you seen chick shampoo ad for hair fall? What does the chick shampoo contain? You might have seen chick hair fall, anti-hair fall shampoo, right? What do they say in that particular ad? What is present inside the chick shampoo? Excellent. They'll be saying egg white. Egg white. The point is, generally when you apply egg white from outside topical, it won't be useful. So this particular ad is not technically scientifically driven. There is a scientific error in the ad. If you add egg white in the shampoo and then use it, egg white will be present only on the surface, it will go off. But you have to strengthen your body from within. The egg has to be going through your body, it has to come out and project outside as the follicle. So the follicles are already dead when it comes to the hair area. So offering protein from outside is not useful. Offering protein from within is actually important. So what are the other associated features? You can have watered area, muscles are weak, atrophic in case of your marasmus. In case of kwashiorkor also, you'll have watered area, muscles undergo wasting, but you can expect vitamin B2 deficiency features. Mark my words, B2 deficiency features can be seen. B2 deficiency features can be noticed in case of kwashiorkor. What are they? Angular stomatitis, chiliosis, oral stomatitis, all these can be seen. So now you tell me, now I give you a small homework. The homework for you is, if you have time, homework for is, find out why in kwashiorkor you have angular stomatitis and cheilitis. Angular stomatitis. Find out the reason behind it. It will take some time for you. It will take some kind of proper searching. If you could give me the exact meaning and the reason why there is angular stomatitis in kwashiorkor, I'll be very happy. So find out the reason for it. So now you tell me, proteins will be extremely less in which condition? Kwashiorkor or marasmus? Proteins will be less in which condition? Kwashiorkor or marasmus? So kwashiorkor. So if I try to measure the serum albumin slightly can reach 3 grams per deciliter in case of marasmus, but is extremely less in case of kwashiorkor. So hypoalbuminemia is an important feature in case of kwashiorkor. So please mark my words: hypoalbuminemia, fatty liver, hypertriglyceridemia, hypoalbuminemia are all the biochemical features of kwashiorkor. Remember, kwashiorkor is even more important 5-mark question than that of marasmus. So kwashiorkor can be more commonly asked than that of marasmus because kwashiorkor has an important role to play in case of proteins. So protein metabolism can be affected in kwashiorkor. That's why people can ask you a lot of questions from kwashiorkor as such. Okay, ultimately, look at the serum cortisol. Cortisol is what kind of hormone we are learning about in diabetes? Cortisol was a very important hormone. For what purpose? It was called as what hormone in case of diabetes or regulation of blood glucose chapter? Kwashiorkor is an example of what hormone? In the chapter of blood glucose regulation. Stressor hormone, hyperglycemic, is this what they have taught you? Is this what we taught you? What is the right kind of word to use? Hyperglycemia can be the result of corticosteroids, but corticosteroids are excellent. They are counter-regulatory or anti-insulinic hormones. So you tell me, hypoglycemia will be more serious in which condition? Marasmus or kwashiorkor? You tell me. Yes, counter-regulatory is enough. The right answer is counter-regulatory. The next is anti-insulinic. I understand. Tell me, glucose levels will be lesser in marasmus or kwashiorkor? Marasmus. So, if at all glucose levels are falling, the counter-regulatory hormones will try to bring the glucose back to normal. So, counter-regulatory hormones can be glucagon and corticosteroids. And in case of corticosteroids, you tell me, in which condition will it be elevated, marasmus or kwashiorkor? Varsha, every kwashiorkor. What is the logic? I am speaking about hypoglycemia. Hypoglycemia means carbohydrates are deficient and carbohydrates means calories. Calories deficiency is marasmus. So you tell me, in case of which condition cortisol should be increased? Yes, excellent, it is marasmus. In marasmus, cortisol will be increased. It will be decreased in case of kwashiorkor because we already have enough amount of proteins. We have enough amount of calories. What we need is proteins in case of kwashiorkor. So corticosteroids is not important in case of kwashiorkor. So increased cortisol can be a marker for marasmus. So this is an important table for you to represent in your exam. Even though you can't represent or reproduce the same table in your exams, at least if you can give me a proper explanation for this, you will be able to do it. So I have given you one homework. Find out what is the reason for angular conjunctivitis and stomatitis in case of kwashiorkor. And I have discussed one MCQ. Try to see this MCQ whenever you try to answer a question because this MCQ can be an indication for seeing whether you are able to be on the right track. If you can go back and revise, it will take a maximum of 5 minutes to 10 minutes to revise the whole chapter of protein energy malnutrition after the teacher has taught you. Then you come back to this MCQ. If you are able to answer the same MCQ again better, then it means you are on the right track. So till we meet you tomorrow morning at same time 10:30, I'll take leave from you. If you have any questions, I'll be open to answer your questions for the next 1 minute. Okay, if you have no questions, thank you, Tata, and a good day. I'll see you tomorrow at 10:30 a.m. Bye-bye. Good night.